Welcome. I'm Dr. Ogi, for those who have never seen me before. And if you receive my thoughts on a regular basis, my thoughts newsletter that's available for doctors, and it's free. You can subscribe to it anytime. Just send me a quick email and we'll talk about it at the end. Many people want to ask me, why in the world do I teach the Practice Evolution program? Like, why do I do what I do? What's the purpose behind it? And of course, the first thing that comes to your mind is, well, he does it because it's a living. He makes a wonderful living, gets to travel all over the place and stay at wonderful hotels and do all this. You know what? Nonsense. That's not the reason. Okay? And I have to tell you that because I laugh when people say this to me. And the reason I teach my program is because I gave up the top practice on the planet to actually do what I do. And the reason is very simple. One day I looked down at my hands and I thought, you know what? I can only help so many people with 2 hands. But if I teach other doctors to do what I used to do, I mean, we can save thousands and thousands and thousands. And that's the reason I do what I do. I'm very driven. And the one thing that bothers me, and I gotta tell you this, is I'm tired of all the hucksters and the salesmanship out there. And I'm tired of really, those people who want us to cheapen what we love and what we do. I'm tired of cheapening the profession. And one of the things that I teach in my program is not to be a salesman. I don't want you to sell. And you know what? You don't have to. People desperately want what we do. The problem is that they don't want back pain care. They don't want neck relief care. And you really don't want your neighborhood to see you like this, for instance. Bob, you got to see Dr. Larry because, he'll fix you right up with that neck crick thing that you've got. Or he'll fix that hip thing that you have. Or that bum shoulder that you're carrying around. See? That's not what they want. What they want is they want people to, they want a doctor they can see with their issue of infertility. They want a doctor that they can see with their issue of asthma. They want their kids free of allergies. They want their dad to be free from his colitis. That's the kind of care that they want, see? And if they find out that this is the kind of care that you provide for your patients, they will knock down your doors. And I can tell you this with incredible certainty. You will need armed guards on both sides of your front door, your CAs with bazookas and Louis Vuitton designer garb protecting your life. And you need a fire-breathing dragon in the moat in front of your office protecting you, because that is what people want. And if you don't have that, they will take you home. Okay? Your wife or husband, your spouse will phone your staff and say, my husband is not home yet. And they'll say, well, he was here all day, but they took him home. I mean, there's a tuft of hair on the floor and an earlobe and the nostril. They took him away. See? Because people want that type of doctor. They want a doctor who is a healer. Okay? They don't want to be sold orthotics. They don't want posture clinics. They don't want stress clinics. They definitely don't want patient appreciation days. And I always laugh at this because to me a patient appreciation day is nothing more than a patient greed day. And whenever a doctor has this, it sends a message to the community. The message is, I am needy. I need new patients. It was really, I have to tell you a cute story. I was doing a screening once at a mall years ago. And I'm sitting there, we got this thing all set up, and this lineup of people, and this fellow was sitting on the table, on my examining table. And he looked at me and he said, well, you're doing this because you just need new patients. And I felt my heart like sink inside, and I thought, oh my God, he found out, And I don't know what, something snapped inside me, and I don't know what happened, but I looked right back in his eye and I said, well, you're right, because that's my purpose, to help as many as I can. And he sat back and he said, that's pretty cool, I like that. And I realized something. People want a doctor who is very committed. They want a doctor who is very dedicated, and they want a doctor who is incredibly passionate about what he does and what he believes in. That's what they want, and that must be reflected in everything that you do in your office. It can't be a procedure. It has to be something that comes from your heart, and it has to be something that exudes from every pore that you have. That's what people want, see? And so one of the things that I want to just talk about very, very briefly is how to be a sought-after doctor. Did you catch that? Sought after. Man, you're all over it. You love the sound of that. Sought after. Me, I am sought after. That is awesome. What a concept. See, now you're practicing from the perspective that people need you. You don't need them. You're not needy. See? I don't want you to be needy. And people, they look in your eyes and they see your need and they stay away from you. They walk around you because that is not the kind of doctor they want to see. They want to see a doctor who really doesn't care if they're there or not. He would like to help them, but he would like to help them on his terms. And that is the way it should be, because this is your practice and this is your life, not theirs. I don't want patients dictating to me what I do. I do, and I'm really good at what I do, and I do that which I feel is best for them. It's really simple. Okay? So I will be talking to you again, and I'm going to cut it off here, but I'm going to be talking to you again about more of these concepts. And you are very welcome to call me at any time, 800-353-3082, or drop me a quick line at Dr. Ogi at practiceevolution.com, and it'll be an absolute joy chatting with you. Take care.